It's time for us to talk health. Now, today on the health segment, we're going to be discussing heartburn, all the issues surrounding it. Dr. Kelvin Owusu is joining us by Zoom this morning, and he is the medical director for Optimal Care Diagnostics, and he's going to help us to get into this conversation. Dr. Kelvin, good morning.
Good morning, David. How are you doing?
I'm fantastic. How are you?
I'm very, very well.
Okay. Yeah. It's good to have you electronically this morning. Let's get into the conversation right away. Heartburn, first of all, what is it?
Well, it definitely is not burning of the heart.
Does it have
It's
anything to
one
do
of
with the
those.
heart at all?
No, it has nothing to do with the heart at all. But you see, in
Okay.
the olden days, or back in the day, because there was no way of investigating where the pain was actually coming from, they assumed that because it's coming from that part of the chest which is close to the heart, when you put your hand on your chest, you feel your heart beating. So when there is
Yeah.
pain in that area, it must be related to the heart. So they call it heartburn. So that's how the name came about. But the
Okay.
technical name is actually acid reflux.
Okay. Now, what is it that causes that acid reflux?
Well, yeah, it's an interesting thing. I mean, there are several causes, but you can categorize them into a couple. So you know that normally your stomach actually produces acid, and the role of this acid is to well, first of all, to kill any germs, any invading germs. The food you eat or the water you drink, some of the germs that enter the stomach can be killed by the acid. And also the acid also helps in breaking down some of the food items, the food particles, so that the enzymes can now work on it. So the acid plays a very important role. So now sometimes there might be situations or circumstances that cause an overproduction of this acid. Some people are naturally, like genetically, they produce a lot more acid than normal. So that can cause an irritation in the esophagus, which is where which is the part of the intestine that passes through the what's it called, the chest. The
Yeah.
esophagus connects the mouth to the stomach. So the acid might be overproduced, and then it backflows into the esophagus, causing the discomfort. It might also be because of an increased intra-abdominal, something causing increase in the abdominal pressure. So people who are overweight, because there's a lot of fat sitting in the stomach, so that fat can push against the stomach and cause even if you produce normal acid, because the stomach volume has been reduced, the small acid you produce is being pushed back up into the esophagus. So that's another situation. Pregnancy can also increase the intra-abdominal pressure and cause the acid to be pushed up. So people who are pregnant are also commonly complain of this acid reflux that we are talking about. In other situations where you have infection, I'm sure you've heard about peptic ulcer.
Yeah.
It's an infection. Yes, it's an infection caused by a bacteria called Helicobacter pylori.
Yeah.
Helicobacter pylori.
Yeah.
Yes, that can also cause a situation where there's ulceration in the stomach primarily. But the cells in the lower part of the esophagus, or let me put it this way, as the esophagus is coming closer to the stomach, there's a transitional zone where some of the stomach cells sort of meet the esophageal cells, and so there's some changes over there, which means that the cells in that part of the esophagus, the lower third of the esophagus, look like the stomach cells, and so which means that the Helicobacter can also infect the cells in the esophagus at that particular point, and so you
Okay.
can also have ulceration there and present with this acid reflux, because it's predisposed you to irritation by the acid from the stomach. And so these are the three. There are more, but these are the three that are commonly found. So overproduction of acid, infection, and then increase intra-abdominal pressure, including pregnancy. All these things can cause you to have an acid reflux.
Okay. Now, let me quickly ask, are there certain foods that also predispose you to heartburn?
Yes, I mean, there are foods that are associated with heartburn. I mean, chief amongst which is spicy food. So if you eat some hot pepper soup, or hot kenke and pepper and fish, and you go to sleep, you can actually experience the heartburn, especially if you lie down flat. Generally for a lot of people, when they lie down flat, very very soon after they eat, they tend to have a backflow of the food they've just eaten, and that can result in some irritation, especially, like I said, the food is spicy. Interestingly, there are other associated foods as well. Some people complain of heartburn when they eat tomato based foods, which is very difficult to avoid, because almost all our foods in this country
Yeah.
traditionally has tomato base, and so it's very very difficult to to deal with that kind of reflux. But generally, foods that are high in acid, like oranges, so that's ascorbic acid, acetic acid foods, all these things can also increase the irritation and cause your heartburn your heartburn symptoms to be exaggerated.
Pronounced, yeah. So what is it about spicy food though? Because I'm just wondering, isn't that the reason why we assume that your heart is in flames? Because if you're eating spicy food and it's causing this feeling all the time, then you automatically connect the two and say, if I eat a spicy, it's putting my heart in flames. What is it about a spicy food that does that?
So generally, spicy food. Okay, so for us in Ghana, when we say spicy food, we are referring to pepper.
Yeah.
Food that has high pepper content.
Yes.
And pepper naturally burns. Even if you eat spicy food with your fingers, you realize that you have some burning on your fingers.
Yes.
So it's natural that you are going to feel burning as it goes down your throat into your esophagus and into your stomach. But that is not the main problem. The problem is that after you've eaten, sometimes 30 minutes, an hour after eating, you realize that the food keeps coming back up, and that's irritation. So now you have a combination of the spiciness and then the acid sort of irritating the lower esophageal area. And that is the discomfort that we are referring to. For most people, it doesn't usually last long. And for most people, they don't even notice it. But sometimes it can be quite significant and can cause disruptions.
Yeah.
And when your heartburn begins to cause disruptions in your normal daily activity, it now assumes a different name, which is gastroesophageal reflux disease.
Okay.
And that's a more serious diagnosis than heartburn, because everybody walking the surface of the earth will have heartburn once or twice in a month. I mean, it's very common. But when this heartburn disrupts your daily activity, for instance, you cannot even go to work, you cannot function normally, be productive because of this heartburn. The irritation is so significant. Then you have gastroesophageal reflux disease, and this requires serious treatment. When you have regular heartburn, most of the time, you don't even have to take medication. I mean, you can just observe it, drink some water, and you're fine. Sometimes you may take an antacid and you'll be fine. But when you have gastroesophageal reflux disease, it requires or it calls for medical intervention to help you live a normal life. Sometimes you may even need to undergo a surgery to cure the problem, because it could be, like I said, if the problem is from an overproduction of acid, sometimes there may be a need to go in surgically to cut some of the acid producing sections of the stomach away, or to remove some of the nerves that supply the acid producing areas, so that the aim is to reduce how much acid you are producing. If the surgical approach is too drastic, there are medications that you may be given to reduce the acid production, because if we don't do that and the irritation continues, you could actually end up with cancer of the esophagus. And so people with gastroesophageal reflux disease need to be very careful, and need to be what they call conscious about the fact that it's a disease that can progress to cancer. And so they need to have regular follow-ups with their physicians, so that appropriate interventions can be taken at appropriate time, because cancer of the esophagus is an actual complication of gastroesophageal reflux disease.
Okay, so the gastroesophageal reflux disease, is that what is...
Hello, David, I think I lost you there.
Can you hear me? Can you hear me? Dr. Usu? Dr. Usu, can you hear me? All right, so we will get Dr. Usu back in just a little bit. But if you have any questions for Dr. Usu regarding this heartburn, it's also described it as acid reflux. If you have any questions at all, the WhatsApp line is 0550-585-832. Just send us your questions. We'll put it to Dr. Kelvin. Dr. Kelvin, is the...
Yes.
Yeah, so I was just going to ask, the gastric esophageal reflux disease, is that what is also referred to as GERD? GERD?
Yes, that's what it...
That's what
exactly.
is... Okay.
Okay. So GERD is the acronym for the, I mean, the long name is gastroesophageal reflux disease.
Okay. All right.
But
okay.
You see, of course, let me just give an interesting thing now. Depending whether you are from the American side or the English side, so there's gastroesophageal, that's GERD, and from the English side is gastroesophageal,
which is
GORD.
Yeah.
Okay. Exactly, it's the same thing.
Okay. All right. Now, in terms of the acid reflux, you said that the management of it is just with antacids. Is that enough?
So if it's just an heartburn that happens once in a while, most of the time you don't even need to do anything about it. You can just leave it and it will go away by itself.
Okay.
However, occasionally if it's severe, you might need to take some antacid, and try and reduce, because an antacid simply neutralizes acid. So when you take an antacid, any acid that has popped up into your esophagus is neutralized, so the discomfort is reduced. And that's all that an antacid would do. But when you have a diagnosis of gastroesophageal reflux, just taking an antacid will not be enough. In other words, you cannot manage GERD at home. You need to be seen properly and get a holistic treatment, because it could also be that you have something we call a hiatal hernia or hiatus hernia. Now, a hernia simply means a content of the abdomen has moved outside of the abdomen. It's not supposed to be there. Now, when it happens that the mouth of the stomach, where the lower esophageal sphincter is, the connection between the esophagus and the stomach is called the lower esophageal sphincter. When it shifts upwards, it means that part of the stomach is now inside the chest, which then means that the lower esophageal sphincter is ineffective, because the sphincter is supposed to be at where the diaphragm is. The diaphragm is a muscle. So when the diaphragm contracts, it closes off the esophagus so that nothing from the stomach comes up. So now if the stomach has shifted upwards, it means that there's nothing controlling. It's an open space. So then acid moves freely from the stomach into the esophagus, and that's a major issue. And so this is just to emphasize the fact that if you have severe heartburns which is disrupting your life, you shouldn't stay at home and be managing it yourself. No. You need to go in and be properly diagnosed, so that if it so happens that it's a hiatal hernia, then appropriate intervention can be done. Because like I said, if we don't do anything about it, ultimately you will develop cancer, which everybody is trying to avoid, because now cancer of the esophagus is very, very, very debilitating, because the esophagus is very close to the lung, it's close to the heart, and so cancer of the esophagus can easily spread to some of these areas, and we don't want that to happen at all. And so if you're I'm repeating this for emphasis, if the heartburn is disrupting your life, your daily activities, you need to report for appropriate medical evaluation and possible intervention.
Okay. So what is it that typically causes the gastroesophageal reflux disease? What is that? How can somebody be perfectly normal and then at a certain point in their life begin to experience this?
So I already mentioned earlier some of the risk factors. So for instance, somebody a woman who has been normal all through her life gets pregnant. As the baby is growing in the womb, pressure inside the abdomen is also increasing. And when pressure in the abdomen is increasing, with the increasing size of the baby, the content of the abdomen is being pushed upwards and downwards to accommodate the baby. So it's entirely possible that as the baby is growing, the stomach may be pushed outside into the chest, like I already explained, so that at that particular time, this woman has a hiatal hernia caused by the pregnancy. Now, nobody is going to do anything about it, because pregnancy is temporary, in quotes. So now, after the baby is born, most of the time, this situation would resolve by itself. But sometimes it does not resolve, and then the intervention needs to be carried out. So that is just one scenario where somebody who was perfectly normal suddenly develops acid reflux. It could also be that fat accumulation in the stomach, because fat also occupies space and applies pressure. So it can also push things out of the way and cause acid reflux. Somebody might get an infection, like I said, Helicobacter pylori. Now, it's an infection just like any other infection. You catch it, you treat it, it goes away, it comes back. Just like you have malaria, you treat it, it goes away, it comes back. So H. pylori also is treatable, but it also recurs. And so somebody may have been treated for H. pylori years ago, it can still develop today and cause him or her to develop acid reflux. And so it's important that when you have some of these symptoms, that's why I say that don't assume that it's normal. I mean, pain is normal to an extent, but when this pain is disrupting your life, any pain that disrupts your daily activity is not normal and needs to be attended to. So if that pain happens to be in your chest, in your heart area, you need to have it looked at so that you can get the best possible care.
All right, thank you. We have some questions coming through. One of them here says, I have persistent heartburns and and always cure this with antacid. Someone told me I'm taking too much antacid. Heartburn comes almost every other day, and as a result, I've stopped eating in the evenings. Will antacid every other day trouble my system? So I guess that's a question relating to how much antacid usage is too much.
Well, I mean, too much of everything is bad, but as to specifically saying how much will be bad for you would depend on which particular antacid you are taking, because each different brand has different components, and so it'd be difficult to tell exactly how much is too much for you right now. However, I mean, taking an antacid every other day obviously is not normal. It means that there's something going on, and so it's good that you have stopped eating late, because late night eating is also a risk factor. Because when like I mentioned earlier, that when you eat and you lie down flat, it causes the content of your stomach to push back. So late night eating is not the best. So it's good that you stop. But if the acid reflux or the heartburn is still continuing even after this modification, you need to seek attention, because you cannot be taking antacid every other day. That is absolutely unacceptable. So seek medical help so that we can get to the bottom of it, so that I can get holistic treatment for whatever it is that you are going through, and then we can, help you enjoy a more normal life.
All right, fantastic. Yeah, another question here says, this is coming from Jacob in Kwewu. He says, I've also been experiencing heartburn almost every now and then. But these days, it's more common when I eat rice and gari. Is that, I suppose that what Jacob is trying to say, Dr. Kelvin, is that earlier on in life, it didn't happen like that. But these days, it's happening, and it's happening more. What do you have to say about that?
So I don't know how old Jacob is, but heartburn also has an age component. Because I mentioned the lower esophageal sphincter is a muscle, and as you grow older, the muscle gets weaker, and so it's possible that you can develop acid reflux later in life. Now, talking specifically about the fact that he experiences when he eats rice and gari, I did mention that some people have some food association. So if you notice that this particular foods trigger your heartburns, the best you can do is to avoid it or to minimize how much you are taking, so that you can enjoy as much a normal life as possible.
All right.
But of course, I mean, the emphasis is if the acid reflux or if the heartburn is disrupting your daily activity, and then you see, you are the only one who can tell that it's disrupting my daily activity. So once you feel like this is disrupting my daily normal activity, then you really have to seek help so that we can do something about it.
All right, and one more question here. Hello, Dr. Owusu. I usually take liver salt every time or anytime I experience heartburn, but the heartburn sensation doesn't seem to go away. This is coming from Mercy in Lashibi.
Well, so liver salt, it's also it does a bit more, but it can also neutralize the acid. So it also serves as an antacid. But if it's not working for you, you can try other, because there are other antacids on the market as well. This one may not work for you, another one may work for you. So you can try other ones and see if it works. But again, the emphasis still remains. If you are having heartburns frequently, if it's disrupting your daily activities, then you really need to seek medical attention to get to the bottom of it. But one thing I forgot to add: overeating also it causes reflux, because when your stomach is too full, obviously, as the stomach has to contract and relax to mix the food and to push it out. So as it's contracting, some of the food will definitely be pushed back into the esophagus. So overeating is also a risk factor for acid reflux and heartburn.
All right. Dr. Owusu, how can people reach you?
Well, I'm very active on social media, so you can find me at Kelvin Owusu MD on all social media channels.
All right. Thank you very much, Dr. Owusu, for speaking to us this morning. It's nice to have you also by Zoom, but hopefully next week we'll have you back in studio as well. Dr. Owusu is the Medical Director for Optimal Care Diagnostics and be helping us to understand this issue, seemingly benign issue of acid reflux, also known as heartburn, but it can be very troubling sometimes. And as he said, it can spill over into an even more serious condition called gastric reflux, gastric esophageal reflux disease. So we don't want to have any of that. Let's avoid overeating and some of the habits that we have. We'll be right back after these messages. Don't go anywhere.